Um, Good evening. Is it visible, Dr.
It
Phil?
is visible.
Yes.
Yes, go ahead.
Yeah, thank you. Thank you. So thanks IVA, React, and WHO India, and thanks to the moderators of this session. Um, at this onset, let me start the presentation on the innovative One Health approaches to reduce the antimicrobial usage and antimicrobial resistance in farms, particularly of veterinary farms. So, quick history of antibiotics. As we all know, it starts with the discovery in Alexander Fleming in the year 1928 of this penicillin, and we have used in the farm animals mainly for therapeutic purposes, metaphylaxis and prophylaxis, which we all know. And the antibiotics in humans, the study has been conducted way back in 2014, and animals in 2012, 30% of the antibiotics are consumed by humans and 70% are consumed by the animals, where the predictions and projections are that by 2030, the global consumption of the antibiotics in livestock will be increasing by two-thirds. And it's alarming to note that a study published by the gentleman Von Buckle in the year 2015, he has predicted that India is one among the hotspots of antibiotic consumption along with the BRICS nation. So in farm animals, mainly the antimicrobial usage comes from the animals, from the foods, and they will be entering the food processing plants. And the major concerns will be in the food chain and the environmental residues as a part of the manure or the groundwater. And in a One Health approach, or individual approach, when we'll be looking over to for health for all concept, we'll be having an individual health, a One Health, which is a practical approach, and a global health, which will be a planetary health as well. So there were a few studies and surveys conducted on AMR in animals across the three continents, mainly Africa, Asia, and Americas, in chicken, pig, and cattle. And the trend of AMR in low and middle income nations are progressively increasing in the years, and it's predicted to come in a highly alarming manner. And when we'll be talking about the foods of animal origin, again, the highest resistance has been noted in food production chain among the tetracyclines, the sulfonamides, and the penicillins, and the rates of AMR may vary with the next generation cephalosporins, ciprofloxacin, and erythromycin, where we are continuously using in the animal sector. And the most common foodborne pathogens that have been exhibiting this AMR include the E. coli, the indicator organism for water pollution, as well as in case of any food safety, then Campylobacter species, the non-typhoidal Salmonella, the zoonotic ones, Salmonella enteritis and Salmonella typhimurium, and Staph aureus. And this was a 901 point prevalence survey conducted from 2000 to 2018, a span of 18 years. And they have in this particular study also, they have reported an alarming rate of AMR, and we'll be coming towards the measures to reduce the AMR burden in the farms. And these measures are classified into four approaches. The first one is the therapeutic approach. The second one is the reduction in the selection pressure. And the third one is the reduction in the transmission of antibiotic resistant or antimicrobial resistant bacteria and antibiotic resistant genes, and the restoration of susceptible bacterial population, because once the antibiotics are mainly used, AMU is being practiced in the farms, they will be disturbing or it will be bringing about a dysbiosis among the commensal flora of the gut. So coming to the therapeutic approach, I'll be dealing the presentation in three phases: the individual health, the One Health approach, and the global health. While we'll be coming towards the focusing on the individual health, we need to have a development of new antibiotics. The new policies should be brought about. There should be the implication, or there should be the implementation of or development of adjuvants and immunoboosters, and vaccines and faster diagnostic tools are the need of the hour when we'll be going for an individual health. Whereas when we'll be moving to the One Health approach, there will be the natural foes like phages or any other alternatives has to be taken care, and the research and development in the global sector has to be highlighted to bring about this particular therapeutic approach. So in the line of this one, we have also few of this alternative strategies like Vergis, license, peptides, the probiotics, the nanoparticles, the herbs, the predatory bacteria and vaccines, where we have also worked on the cationic peptides and the probiotics, and we have got interesting results, and our results are getting tested in the larvae model, and further we have submitted a proposal to get it tested and clinically translated to the mice model. Coming to the second part of the management is the reduction of selection pressure. It is mainly brought about by the evidence-based prescription by the practitioners, be it veterinarians or the farm managers. And the awareness has to be brought about for the local resistance among the public. And there should be apt and appropriate delivery systems where we have to target the antibiotics at the point of infection. And when we'll be coming to the One Health approach, the surveillance has to be taken care, and the control and supervision of the sale of antibiotics should be thoroughly taken care, and local guidelines should be enforced. And while we'll be using these antibiotics, we have to use non-antibiotic compounds for prophylaxis and metaphylaxis in case of One Health approach, as well as in global health approach, we have to bring about regulations. Suitable regulations has to be implemented in this particular area. And WHO already has taken this initiative into consideration. And from 2016 onwards, they are categorizing the antibiotics and the pathogens based upon the critical, high, and medium. And CDC also, they have categorized into 2019 as 4 categories: the watch, concerning, urgent, and serious category. And recently in 2019, WHO has implemented or developed or released an aware classification of antibiotics, wherein the antibiotics are classified into 3 categories: the axis, the watch, and the reserve, which we also have to take into consideration while we'll be implementing in our practice in farms and hospitals as well. Then we'll be going towards the reduction of selection pressure, wherein the surveillance of commensals has to be taken, because the commensals can also gain its antibiotic resistance to plasmids or intergrowns mediated approach. And then moving on to the One Health, we have to give more emphasis towards the hygiene and sanitation part and surveillance part. Considering the farm approach, we have to give emphasis towards the effective biosecurity measures within the farm, because we have to take care of the diseases which are coming from the farm, and we have to take care of the diseases not to go out from inside the farm as well. And cleaning and disinfection of animal housing and equipments should be taken care. The stocking density has to be taken care. The manure is also an important source, and we have to give personal education as well. And while coming towards the good animal husbandry practices, we have to take care of the clean housing, avoiding the overstocking of the birds or the animals, livestock. We have to provide good lighting and air quality. Nutritious feed has to be given, and regular and routine veterinary advice and the vaccination schedule is to be taken care of at most importance. While we'll be taking the fourth measure to control the AMU or AMR in farms, we have to restore the susceptible bacterial population by preserving the autologous microbiota. And here comes the alternative approaches. And there are certain innovative approaches like the genetic engineering approaches mediated by CRISPR-Cas gene editing tools also, to bring about this restoration of commensal gut flora. And in this line, we are taking an alternative approach in our university in collaboration with NRC Meet and Nagpur Veterinary College on the nanoparticle conjugated phytochemicals to combat the antimicrobial resistance in poultry. Before concluding this session, I'd like to give a take-home message that this AMR or AMU has to be reduced by these methods, which includes the prevention of infection by way of good animal husbandry practices, by ensuring effective biosecurity measures. Relevant vaccination schedule has to be followed, and there should be a free dialogue between the farmer and the veterinarians, and we have to avoid unnecessary use of antibiotics either for prophylaxis, for growth promotion, or for metaphylaxis conditions. And we have to avoid the use of antibiotics which are critical to the humans, and wherein we will be using, we have to use the right pharmaceutical, and that too the evidence-based prescription has to be followed and in an appropriate manner, which has to be recorded, and the feedback has to be passed on to the veterinarian. And to sum up, we have to have good animal husbandry practice, the prudent use of antibiotics, the animal health and welfare and productivity, ensure the biosecurity, and relevant vaccination has to be brought in this one. And in together, a One Health approach has to be implemented in order to ensure the reduction of antibiotic resistance and usage in the farms. Thank you. Thank you very much for having given an opportunity to present on this particular area. Over to the moderators, please.
Thank you, Dr. Jess, for an overview on how we can reduce the usage of antibiotics and have stewardship at the farm level. I think we can take the questions at the end, probably. Dr. Philip?
Yes, sir. Yes, yes.
That will be okay. Okay. I think we'll move on to the next presentation. Dr. Kate is available?
Yes, sir. I'm just bringing my presentation up. Thank you.
You could start sharing your presentation, Dr. Kate.
Thank you. Is that coming through?
No, not yet.
That should be coming through now. Is that coming through?
No, it hasn't come yet.
Okay. Okay, showing that it's sharing my end. Let me just double check. Okay, let me just try again. Okay.
It's come, it's fine.
Yeah, it's coming.
Yeah. Okay.
Yeah, that's fine.
Thank you very much for the invitation. I'm from World Animal Protection. Our mission is to move the world to improve animals' lives. I'm from the Animals in Farming team, and we also deal, of course, with food systems. This map shows that our offices around the world, but it also reminds where AMR impacts the most, particularly around low and middle income countries. We liaise with organisations, including REACT, with our colleagues in India, the Antibiotic Resistance Coalition, the EU Public Health Alliance, the Alliance to Save Our Antibiotics, and also consumer organisations, companies and governments. First of all, just a little bit about what animal welfare is, because many of you might be veterinarians or you might be public health scientists. It's essentially the intersection of the physical, mental and natural aspects and behaviours that animals find important to them. And that can be a range of things. Moving on, as veterinarians, for those of you, you might be familiar with the 5 freedoms, which was developed in the 1960s by the Farm Animal Welfare Council in the UK. But a more modern model is the 5 domains. The first 4 domains, as you can see here on the slide, nutrition, environment, health and behaviour, ultimately are inputs which are channelled into the 5th domain, the mental state of animals, and that can be positive or negative. For animal welfare, ultimately, it is important and it is no longer enough to consider just the reduction or the removal of negative welfare states like suffering, pain or distress, but it's also important to provide for a balance of opportunities for positive mental states, vitality, comfort, satiation, play for learning, pleasure, etc. It is also important to consider the current and cumulative welfare across the whole of life of an animal. And this is accommodated by the quality of life scale, also brought about by the Farm Animal Welfare Council. And that is a continuum as shown on that scale. And they assert that adequate welfare or a life worth living with minimal suffering should be the very minimum of national legislation, and that we aspire to a good life with predominantly positive experiences for animals. So getting more onto the current state where we're at, during the pandemic, obviously for food systems, food chains were disrupted, as we know, factory farming systems were vulnerable, workers were obviously at high risk, and people and animals suffered unnecessarily. It was a great wastage, and dietary changes were impacted. And of course, we reflected on our food system for transformation. And Marchant, Ford and Boyle, two academic scientists, reflected in detail how these impacts on the livestock production system in one welfare sense. I won't go into detail. And so we also released this year our Fueling the Pandemic Crisis report. And as the previous speakers already highlighted in detail, we know that superbugs can reach people from farms, the food chain and the environment. And we know that antibiotics are propping up low welfare farm systems, which also enable diseases like bird flu, swine flu and other endemic diseases. And the UN released here also that shows that intensive farming systems are responsible for more than half of all infectious diseases between animals and humans since 1940. But also during this pandemic, we know that up to 90% of hospitalised patients in some reports were treated with antibiotics, many the same antibiotics that were given to healthy farm animals for disease prevention. So we know that antibiotic use and AMR can complicate treatment and further exacerbates the public health burden from pandemics. And as expressed globally, 75% of antimicrobials are still used in farm animals, and around 50 billion farm animals are still factory farmed. And we know that they're still used to promote growth and routine group prophylaxis. So given essentially to healthy animals where no disease or confirmed infection is proven. So in terms of welfare, these are low welfare systems, cages, overcrowding, mutilations or painful procedures, intensive breeding for fast growth, early weaning, animals deprived of their basic behaviours and needs. And just more locally, to bring it home, one study from northeast India by Sharma et al. 2019 showed that for the salmonella that was sampled, 100% was multiple drug resistant from retail chicken farms and retail outlets, and 41% was co-resistant to some of the highest critically important antibiotics. But our report also highlights that reduced antibiotic use in food-producing animals is associated with a reduction in antibiotic resistance in people. We also decided this year to ask what the global public and consumers think about these concerns. We conducted a polling across 15 countries involving over 15,000 people, commissioned by Flood and Partners. 88% of global consumers are concerned about the possibility of superbugs coming from farm animals. 85% think that antibiotics should only be used in farm animals that are sick, and 3 in 4 global consumers would be prepared to switch to higher welfare meat. Respondents from India underestimated the antibiotics used in farm animals, as most did. 92% were concerned about superbugs from farm animals, and 90% were concerned about pandemics. 2 in 3, or 2/3, say that governments should act. 90% want animal welfare laws strengthened, and 81% want antibiotics in farm animals further restricted. And we know that welfare can be a key part of the solution, as the previous speaker mentioned, but it actually can be quite a bit simpler. So we know that if you actually address the underlying problems in farming systems, you have animals that are less stressed, more robust, there's less disease, simply less antibiotic use. And some of the European countries have been leading in this area. So whilst the Netherlands set targets for their industries already, when they converted in 2016 for their retailer, their retailers came together and decided for their domestic chicken production to use slower growing broiler breeds, they were able to considerably further reduce their antibiotic use in their chicken farming. So overall, they've been able to reduce their use of antibiotics in chicken farming by 63%, but that was considerably increased when they changed to slower growing broilers. There are other examples that they provide in this report also with pigs. But closer to home in India, we've been working for the past 2 years with Abbott Nutrition India, and this was with smallholder dairy farmers. And when we worked with them to convert from tethering farms on smallholders to loose housing, and that involved also a range of other improvements by definition, we saw with all farmers reporting better health of their cattle with less need for treatments, antibiotics. And so simply by simple changes, we were able to see less need for antibiotics. And there's some other system approaches, sort of high-tech examples perhaps from the Netherlands, the Winstreek broiler type farm, which is not only energy neutral, but higher welfare. The Kipster type farm, also from the Netherlands, which is an egg farm. And then also simpler, lower technology examples with agroforestry and egg type development projects from Africa and Colombia. But finally, also by Van Berkel et al., he took some modelling approaches and different approaches to global reduction of antimicrobial consumption in food animals. He looked at tax approaches, user fees, etc., and also reduction. And we know that global meat reduction can be a key to global food security, climate crisis mitigation, and a complementary solution to AMR. We, as an organisation, view meat reduction as a key to transformation of the food system, where per capita consumption is currently greater than WHO recommendations. And as you can see under Target 2, this can help to achieve a significant reduction of antimicrobial use. So this is for a key consideration. So finally, we need to move towards a food system less dependent on antibiotics, and a higher welfare and sustainable food system is really key. And as you probably know, the EU will prohibit antibiotic group prophylaxis use from 2022. And India must consider following that so that there is a level playing field. And the strategy is important, as others have spoken about, setting antibiotic use targets and animal welfare standards. You've got to solve the underlying problems in these farming systems. You can't just replace with another technology or another fix. And you've got to incentivise farmers, as others have mentioned, help them to transform. There are specific standards that we recommend under the Farms Initiative. There can be private and public finances that enable this, working with banks, etc., and public funding. And then when there's opportunities to develop new farms, high welfare farming can be better for people, planet and animals. And we have our India Dairy High Welfare business case on the right, which is available from our website. So whether it's chicken, fish or dairy farming in your country, small farmers, we know, low income and rural communities will often feel the impacts of disease and AMR the worst. So resolving the underlying welfare issues and not necessarily just the biosecurity is a key point. And we know that the externalities of AMR are felt disproportionately by these people. So assisting them and incentivising sustainable systems rather than just the quick fix, as we know, using antibiotics as an insurance is key. And this is going to be really important, not just for food security and economic security, but also public health as well as animal welfare. Thank you very much.
Thank you, Dr. Kate, for that wonderful presentation, a very crisp presentation on your new insight on bringing in animal welfare. That is a less stress, less of antibiotic usage. So thank you very much. Shall we go on to the next presentation, please? By Dr. Devika.
Yes, good evening to all of you. I thank Dr. Philip of React Asia Pacific and Dr. Robin for inviting me and giving me this opportunity to make my presentation. I think I'm a little hard pressed for time. I will quickly run through my presentation. I would like to share what we have been working on, and an aspect which sometimes a very important aspect of AMR, which I think is very often overlooked or missed. So that is the surveillance of AMR in aquaculture and aquatic environments. As Dr. Anuj was saying, AMR is a silent pandemic, and therefore maybe it's very often overlooked. But since I'm working in the aquaculture and fisheries field, I would like to stress the fact that the aquatic environment acts as a reservoir from where the effluents from all the other industries, the hospitals, the farm, and all the other sectors, the domestic sewage, everything enters the aquatic environment, and therefore it is a reservoir of the antibiotic resistance, and therefore it becomes a channel for the spread of clinical resistance traits. Now, we were a part of the CARSAP, and we started a study looking at the aquatic environment and the prevalence of multi-drug resistant isolates near hospitals, and also the prevalence or transfer of the presence of antimicrobial resistance and the transfer of antimicrobial resistance into other aquatic organisms. We selected across Kerala, as there are other people from other states. Kerala is a very thickly populated state, and with all hospitals, industries, and everything very closely located, and even the urban population very close to all this. We are very blessed with a large number of water bodies, and therefore the aquatic environment is all the more important when you have to do a surveillance for AMR, because it affects in both ways. A study of the aquatic environment adjacent to hospitals, and we had selected some aquaculture farms which were at downstream of the water body, which was close to these hospitals. And what was alarming was that we found a very high prevalence of multi-drug resistant isolates, as high as 65 to 70% of the isolates were multi-drug resistant. And from the associated aquaculture farms, almost 40 to 45% of the isolates were multi-drug resistance. The pattern of resistance was quite similar. And to ascertain whether the origin of these isolates were from hospitals, one of the indication was that further away was the aquaculture farm from the hospital site, the number of resistant isolates were decreasing. The pattern was similar, but the number of resistant isolates was much fewer. We screened for different multi-drug resistance genes for the quinolones, ESBLJ, carbapenem, and so on. And to just point out a study with quinolone resistance, which we found in about 45.4% of the isolates, which were highly resistant to quinolones. We found it quite strange that it was so highly, the isolates were so highly resistant. So we checked the sediment in that particular site for residue, and we found that, to our surprise, we found ciprofloxacin residue at the rate of 15 ppb, which is very high, and in the sediment. So that was a very an indicator that a lot of discharge is going into the aquatic environment from the hospitals, and therefore a reason for the spread of AMR to the isolates in the aquatic environment and for its spread. This is just just to show you the presence of the different types of quinolone resistance genes, as well as the presence of functional antimicrobial resistance through different means. This is the efflux pump in some of the isolates. We published research in 2 of the major journals on quinolone resistance as well as carbapenem resistance. So the take-home message from this part of our study is that we require constant monitoring of our hospital wastewater, which is not being treated significantly at this in the present time, and therefore we need to make the policymakers aware that the antibiotic stewardships have to be strictly implemented to protect our water bodies. Coming to the second part of my talk, I will very quickly talk about how we looked at the AMR prevalence in the isolates in aquaculture farms. Kerala does not have because I work very closely with the aqua farmers. I know for sure that the farmers do not use antibiotics in the aquaculture systems in a big way. I mean, very, very insignificant use of antibiotics directly in the aquaculture system, particularly for food fish. But in the aquaculture, certain food fish, where they use raw poultry as feed for fish, we have found the prevalence of multi-drug resistant isolates as high as 71.2%. So this comes from the raw poultry waste. So the same fish where the farm, in those farms where they were using pelleted feed, there were very, very insignificant numbers of resistant isolates. So clearly pointing to raw poultry waste being the source of the bringing in the AMR or antibiotic resistance in the aquaculture farms. Since I do not have more time, I'm skipping all this. So the take home, so what is the way forward? It would be enhanced antimicrobial surveillance would be one of the strategies to guide the control of antibiotic overuse and misuse, increasing the awareness of farmers, general public, and policymakers. This is one very important aspect because we do have regulations on the effluent release, but it is not implemented, hardly any implementation from hospitals, be it industrial or domestic sewage, which is being released into the aquatic environment. So there should be a strict implementation of the regulations for protection of our water bodies, and therefore that directly affects the aquaculture farm in Kerala. So that is the take home. And promoting appropriate use of antimicrobials. That is one major area where we work, that we look at the alternate strategies which to provide solutions to the farmers instead of antibiotics. So as Jess, Dr. Jess was pointing out, we also have been working on nanoparticle conjugated phytochemicals. We also work on probiotics and advise best management practices adoption in the farms. So we have farmer groups, and many of the farmer WhatsApp groups are very active. So we promote and encourage the farmers towards best waste management, best adoption of best aquaculture practices. Yeah, so before I conclude, I would like to show the participants the result of the poster competition, which was announced by Dr. Philip a few minutes earlier. This is the first prize, the poster prize, antimicrobial. The theme was antimicrobial resistance in the aquatic environment. The first prize was won by Kirtana PS. This is the poster. The second one was won by Maria Teresa Vergis, and this is the second prize. The third prize was this in the poster competition, won by Avin Ramanan. In the collage competition, the first prize was won by Mohammad Nadim Ansari. The second prize was won by Mr. Suraj NS. And the third prize was won by Avin Ramanan from St. Thomas, Thrissur. So this is an attempt by the university to promote awareness on antimicrobial resistance in our university, which is the Kerala University of Fisheries and Ocean Studies, to generate the awareness among students to look for alternatives and encourage farmers towards best management practices. Thank you, one and all.
Thank you, Dr. Devika, for that very insightful presentation, wherein now we know that, everything is in the big cycle there. So I think we need to be working together to fulfill the mandate which is there, and then only then we'll be having that result in place. So can we have the next presentation on international efforts to understand and contain antimicrobial resistance in farm by Dr. Arshnee?
Just unmute myself.
Yeah, that's fine.
Yes. Hi, can you see my presentation and hear me?
That's right. That's fine. That's fine. You could start the presentation.
Thank you. So good evening from Nairobi, Kenya. My name is Arshnee Moodley, and I lead the CGIAR Antimicrobial Resistance Hub that's hosted by the International Livestock Research Institute, as I said, here in Kenya. This is not, give me one moment. Yes. So if you're not familiar with the CGIAR, it is a global partnerships that is aimed at reducing poverty, improving food and nutrition security, and improving the natural resources and ecosystem services in the global south. And this is directly linked to the achievement of the UN Sustainable Goals. What we do know is that tackling antimicrobial resistance is also very crucial to achieving those sustainable goals. And antimicrobial resistance can have direct impacts in terms of reducing, affecting human and animal health, but indirect impacts in terms of reducing productivity of animals, which will then have economic impacts. So because of these sort of the tight relationship between antimicrobial resistance and the achievement of the UN Sustainable Goals, this then led the CGIAR to establish the Antimicrobial Resistance Hub, which is focused at trying to understand the agricultural associated AMR risks. So this is the hub, and the hub is built on 5 pillars, and it was formed together with different CGIAR partners that include World Fish, our policy partner in Washington, DC, and the Water Institute that's based in Sri Lanka. And together with a number of partners in our research programs, like the London School of Health and Tropical Medicine, we also have partnerships with the new Danish initiative called ICARS, and we work very closely with national partners when we are conducting our different research. And really our research is focused on trying to understand why are antimicrobials being used in the different value chains, how are drugs being procured within the system. We're also interested in understanding what are the levels of resistance at the different interfaces and how are they exchanging resistance between them. We have a focus on interventions, understanding in a low and middle income context, those interventions that will be effective as well as be cost effective to the farmer. And I think that that's an important thing. We also engage with policy. We understand the policy environment in the hope that we can then sort of move the tide towards better understanding of what is needed in order to reduce resistance as well as reduce usage. We also have a big focus on building capacity. This includes mentorship of fellows within surveillance programs, for example, the Fleming Fund fellowships, but we're also sort of focused on building the capacity in terms of diagnostics, AMR diagnostics. So one of the things that everybody has discussed, and I want to reiterate here, is that AMR challenges in the agricultural sector are very many. And that when we want to discuss challenges, those challenges, we need to understand where are the different sort of areas that we could then invest in. So the very first thing that sort of underpins all of this is the high prevalence of infectious diseases. And while we have information about what that burden is in humans, we have little to no information about what is the burden in animals. And this is then compounded by limited access to veterinary services. So either there's not a veterinarian for miles, or the cost of having a veterinarian come to your farm to do a diagnosis is too much for a farmer to bear. This is then on top of that, we have limited diagnostic capability, be it that the sample is not taken to the lab, is taken from the animal and sent to the lab to determine what is in fact is causing the infection, and then what is the susceptibility profile if it is a bacteria. More than that, we have either little to no surveillance of antimicrobial resistance or usage of antimicrobials. And somebody is writing all over my screen. But the data that we do have is that they come either from indicator bacteria or from zoonotic pathogens. The other thing is that if we want farmers to reduce their use, what we need to also be able to give them is effective alternatives. And basically, we cannot really provide any cost-effective alternatives right now for farmers. On top of that, you can add little knowledge amongst users as well as the prescribers. A number of CAP surveys being done amongst farmers as well as those that prescribe antimicrobials, to try to understand, what is the level of knowledge as well as how are they practicing, what are the practices around antimicrobial use. And it's quite clear, and across a lot of the different studies, is that this tends to be very low. The other thing is that antibiotics are actually quite easy to access by farmers. And also in terms of cost for the farmer, it's one of the cheapest things for them to buy. And then we have to, if we add on top of this sort of resistance problem, is this sort of influx of substandard and counterfeit antibiotics. So there are many challenges sort of related to antimicrobial resistance that we sort of need to tackle, all of them really, to truly be able to move the needle as has been done in high income countries. And part of that is also then to build an economic case for investment to be able to invest in AMR or tackling AMR. So this is sort of an overview of the different activities that we have globally. So as we are, we're based in the global south. We have a number of different countries in which we have offices in. And so the primary our work is in Africa, but we also have work in South and Southeast Asia. And in different countries, we're trying to understand what are the drivers for use, what is the level of knowledge, and we're trying to do that in different value chains. So it could be poultry, dairy, pigs, or even crops, really. We're also, as I said, we're trying to sort of understand at the interfaces, how is resistance being transmitted between the different populations. As I said, we do interventions, but I think it's important to also include what is the economic impact in order to make a case to a farmer that if he reduces his usage, he has something else that will then not reduce his productivity. And as I said, we're working on capacity development. We also have some products, also projects looking at crop production. More and more sort of research is coming to surface to show that actually antibiotics are being used in various crops, particularly in citrus production as well as in rice production. And we're yet to really, I think we're scratching the surface there to truly understand what is the sort of the relevance of that from a human health perspective. But this is also then linked to animals, because we use manure from animals in order to fertilize the fields, and we also use wastewater or farm effluents for wastewater irrigation of the crop fields. And we're really trying to understand that in a One Health perspective, how are the two sectors linked to each other? And if we really want to make a difference in one, what will be the impact on the other? So one of the things that I was asked to speak about is the sort of the farm level use of antibiotics. And I think it's really important to understand why would a farmer need to use antibiotics. And these are typically can be broken into two sort of arms or areas. One is the medical use, and we can discuss a lot about even though the animal is sick, is it really sick because of a bacterial infection? We have reports, particularly from here in Kenya, of sort of an East Coast fever or antibiotics being used to prevent African swine fever. So sort of diseases that are not typically associated by bacteria, but because farmers are based on their own knowledge will then use antibiotics because they think that this will work. And then you have all the non-medical usage of prophylaxis, metaphylaxis, and growth promotion. And I think one of the things that what we really, really need is a better understanding of what is happening at the farm level, how much antibiotics are being used and for what purpose, to be able to say that this is where we need to make the investments in order to reduce usage. And OIE has noted in their last report on sort of global usage of antimicrobials that yes, countries are reporting using it as growth promoters, despite the fact that there may be regulations in place, and some countries don't even have regulations to reduce or ban that use. And there are a number of barriers as to why we don't have that kind of data as we would normally find in high income countries at the farm level. And that is really related to sort of discussions between the different ministries and as well as private sector, tools and resources in order to capture this kind of data. But this is also then linked into the way in which we diagnose infections in low and middle income countries compared to high income countries. And I want to give you two examples. One example is from my country, Denmark, and then I'm going to try to give you an example of what happens in a low and middle income country, just to kind of give you a flavor of the different factors that will influence how a drug is used. So for example, in the Danish model, there are really very few ways in which a farmer is able to get access to an antibiotic, and under very few circumstances, he himself will prescribe that antibiotic. So typically, not typically, the only way in which a veterinary diagnosis can be made is by a veterinarian, and a veterinarian has to visit the farm in order to see the animal to then make a diagnosis to determine what the treatment will be. And this is really very, very important, that if you have this very rigid system, and therefore the only time that a farmer can actually go to a place to buy antibiotic is at a pharmacy. And it's the very first same pharmacy that I would go to in order to get my antibiotic. But this is then coupled with so many initiatives that have been going on for the last 25 years to reduce usage and to also reduce the levels of antimicrobial resistance. And this is based on very, very detailed surveillance systems, as well as sort of demanding flock treatment. When you do flock treatment, you have to have a laboratory diagnosis to confirm that. We also have differential taxations on drugs. And then we have the Yellow Card Initiative, which monitors at the farm level how much antibiotics are used. And if you reach a certain threshold, a sort of a system goes off, or a signal goes off, and then you have to look at what issues you have in your farm in order to reduce your resistance. But if we go to a low and middle income setting, there are so many different pathways that will lead from the time an animal is sick to a time that that animal will get an antibiotic. And really, there are so many factors that will influence the decision-making sort of tree and at different nodes. And this could be the fact that a farmer can call a veterinarian, but he's not available because he's in a remote area and there's no vets to come. So that option is not available to him, or he simply doesn't have the money to pay for the vet because he has to pay both for the consult as well as the transportation. And then on top of that, he has to buy the antibiotic or whatever drug the vet will prescribe. So he will find other ways depending on what is influencing his decision. If it's a high value animal, maybe he will seek a veterinarian. If the animal is not that sick and he thinks he can self-diagnose it, he will do that himself. And so there are different pathways that influence that. And there are various players that then sort of influence what actually happens and what drug is purchased and things like that in the system. So it's a very difficult system to regulate when you have these multi-players or actors that are either not really thinking about what the farmer needs or the animals need, but maybe also thinking about themselves. And cost is a very important factor that drives a lot of the decisions here. So what are we doing at the hub in order to address antimicrobial use and resistance? And really, it's many different things along the different pillars that we are interested in. But one of the very first things is try to understand, well, what is driving the use, and how do we understand how a farmer is accessing antibiotics? The other thing is also to understand what is driving prescription. Then we want to also look at drug supply chains, and this includes formal and informal and illegal ways in which drugs are coming into the country, as well as then the policy environment around antimicrobial usage, registrations, import of drugs. So particularly here in India, for example, we have a project with FSSAI to try to understand at the macro level how much drugs are being imported in the country, how much is exported, what is manufactured locally, and try to understand, from that macro level, what is being used on the ground. And then we do the more traditional microbiology to understand resistance and how is that being spread from animal populations into human populations. We look at ways of trying to deliver knowledge to farmers. And so what ways will work best? And one of the things we're looking at is this community of practice conversations where farmers get together and share their experiences. The other thing is not necessarily related to antimicrobial resistance per se, but really is to try to improve access to veterinary services as well as promoting vaccines campaigns. So in a way, just improving herd health so that you reduce the burden of disease. Another very important sort of aspect is interventions in the low and middle income settings. So a lot of the data or studies that you will see has been conducted in high income countries, which we can't really translate to our own settings here. So if we are able to provide these alternatives in the settings that we find ourselves in, maybe there would be better uptake of those interventions together with the economic or cost benefit analysis. We have established an antimicrobial susceptibility testing lab here in Africa. And this is together with UCOST to be able to create a training center for the continent without having the need to travel. And of course, COVID has also exacerbated that need to be able to deliver good training locally. The other things is to try to understand resistance in a One Health perspective, and how are all these sort of linkage or niches or pathways are interacting with each other. And so if you do an intervention in one sector, how is that really going to have an effect on the other sectors, and vice versa? So what do we need more of? And I think if we think back to the sort of the slide that I showed you about the challenges, I think we need many, many different areas. One thing is on the farm in the need for cheap diagnostics to be able for the farmer or the veterinarian to say, we have a bacterial or viral or parasite, and therefore in order to be able to say whether this needs antibiotic treatment or not. We need better access. We need to address how farmers access veterinary services and provide them with the knowledge or this access. Another important thing is knowledge on local resistant patterns, because this will then inform your treatment guidelines. So if we know exactly what is circulating in the population, we'll be able to say what could be empiric treatment or not. Another thing is evidence-based treatment. So this is taking a sample, which is very much linked with antimicrobial stewardship. Data storage and sharing mechanisms. A lot of places that I work in still use paper or do not store any data. And I think we kind of need this data, this retrospective data, to understand where we are and where we want to go, and what has been the effect of different interventions. As I said, we need cost-effective alternatives that also reduce the farmer's access to antibiotics, but improve his animal husbandry practices. And one of the big things that also came out of the World Bank report is AMR sensitive interventions. And one of the things is that maybe we don't tackle one problem, we tackle multiple problems at the same time with one or two interventions. And this would probably be a better cost effectiveness for low and middle income countries where we have limited resources. Better enforcement of the regulation. A number of the countries that we work in, there is regulations, very clear regulations. It's just difficult to enforce because of financial resources and human resources. So how do we address that instead of just making more regulations? The other thing is we need is a better social contracts. So the understanding that what I do may not be of direct benefit to me, but may be of benefit to my neighborhood, my community, and to try to enforce that. We need a gendered lens. We know that maybe that women take care of the livestock, but not necessarily the ones that are making the treatment decisions. So how do we take that into effect when we want to discuss reduction? Another big thing is making an economic case. The number of the countries that we work in, antimicrobial resistance is not one of the top 5 priorities because they are tackling HIV, tuberculosis, malaria, a number of other issues. So how do we make an economic case for investment so that the countries can prioritize that? And basically what I have in the next point is taken from the Global AMR Hub, which is trying to show what has been the investment in AMR globally, but you can also look at different countries. And basically it's just to show how much has been invested in the human health sector versus the animal health. And just for Africa, only 2% of that investment has been on the continent. And really, what does that say about our investment when we need to be able to do all of these things to tackle AMR? So one of the parallels with AMR and COVID is one thing I think COVID highlights the importance of diagnostics. The fact that we cannot diagnose an infection will have an implication on how we treat that infection. The other thing is the impact of no treatments. We talk about a post-antibiotic era, and I think COVID very clearly kind of shows that, is that if you don't have treatment, this is what we have. No vaccinations, what is then the sort of the effect of that in the current global crisis? And this disproportionate effect between high income and low income countries. And I think one of the things is that, you know, because it's a silent or this invisible pandemic, it's not so tangible. So it makes it very difficult for people to truly understand it. And then if we continue to put the AMR agenda, is this then another program overload, a problem overload? So how do we continue to kind of shine that in light of everything else? So that's really my last slide. And I just want to thank Philip for inviting me to be here today to share with you what we've been doing at the Hub. And you have my email address or you can Google me and I'll be happy to talk about what else we do. Thank you very much.
Thank you, Dr. Arshnee, for that very wonderful presentation, a very crisp and You have taken us through the challenges in the agriculture sector and what exactly needs to be done at the farm level. Thank you very much for that presentation. Can we have the next presentation by Dr. Jitendra Sharma, please, on controlling antimicrobial contamination in the environment?
Yeah.
You could share your slides, please, Dr. Jitendra.
Yeah. Can you see the presentation?
I think it's coming. It's coming. Yeah.
Yeah.
You could put it up in the presentation mode.
Okay. Can you see this?
Yeah.
Okay. Okay. Thank you, Dr. Sunil. Thank you, Dr. Philip, also for inviting us, and many thanks to Dr. Anuj, who has connected us with React Asia Pacific and the organizers. And we are very glad because it is very important to also link health, apart from health aspect, also the environmental aspect to the AMR. And just to give a brief introduction, that UNEP, of course, works on environmental aspects as a UN specialized agency, but we are very new in India. We are barely 4 years or less than 4 years old in India. We started our operations in India office probably in 2016, late 2016, and then we have now moved into. My presentation is very small. I'll be briefing on what are our priorities to work in India. And I'll also be looking forward to have a larger association in future also with all the expert agencies and experts when we are doing this particular work on One Health in India. So as a lot has already been spoken about the general antimicrobial resistance, I just want to highlight one point from my slide is during 2017 Frontiers report, UNEP identified AMR as one of the 6 emerging issues of environmental concern, and that also prompted taking AMR and environmental health as one of the important aspect during the United Nations Environment Assembly. I'll come to it later in other slides. There are some documents very recently on Friday we released a press note on Antimicrobial Awareness Week. I have taken this particular diagram from the press release of UNEP, which mainly focuses on how the antibiotics are entering into environment and what are the impacts. I will not go into detail because a lot has already been spoken than I know during the previous presentations. But the context mainly, UNEP works through the resolutions of United Nations Environment Assembly, which identifies the priority areas, and member states give us a mandate. So during United Nations Environment Assembly third version in 2017, there was a resolution on environment and health, which identified one of the area UNEP to work with tripartite and also develop a report on AMR and environmental dimensions to be presented in the 5th Assembly of United Nations Environment Assembly. So that report is under preparation. We will have this report probably next year when we have virtual UNIA in February, March 2021. There are aspects linked to this. Of course, Anuj has already mentioned about National Action Plan, State Action Plan has also been discussed, Delhi Declaration, we know. This is also a general slide, how One Health response to AMR is important, and we are glad to be part of a lot of such organizations and group where we are working together along with other organizations to tackle this. As one of the initial activity on AMR and environment in India, we are in the process of initiating a project on identifying priorities for environmental dimensions for AMR in India. This particular study mainly focuses on the policy issues of AMR. As we already know that there is a comprehensive AMR 5-year action plan for India, which has been developed and submitted. There will be a revision of this AMR document after the 5 years. So our focus mainly is to work on the environmental aspects, carry out research activities, and also identify policy interventions to inform government officials to incorporate environmental aspects appropriately in the new version of the strategy of 5-year strategy of AMR action plan, also coupled with outreach activities and awareness raising activities. And these are the major inputs which we would like to do. Similar project is also being implemented or is in the process to in other countries of Asia Pacific, basically in Thailand, Philippines, and possibly in Vietnam. So we would also be providing inputs from Indian learnings to the overall Asia Pacific document on environmental dimensions. So these two projects will be implemented simultaneously in different countries, and we will have learnings from different countries and exchange of information. So what we would like to do under this project, mainly we would like to prepare a state-of-art report on AMR and its linkage with environment in India. Then we would like to develop a summary for policymakers, which can feed into the update of National Action Plan on AMR in the next version. And third is, of course, awareness raising. And we would like to do it through stakeholder consultations, developing a draft report, review of the draft report by with stakeholders. Then again, some sort of more consultation to get inputs from experts, what is missing, what is to be added, what is already there in the action plan, all these things. And also, then of course, dissemination of information to the stakeholders and awareness raising activities. We have identified few stakeholders already in our project proposal, and we would like to have more partners to be involved in the consultation program. We are in touch with, so the National Center for Disease Control has suggested us to work with Indian Council for Medical Research as a lead partner, and we are in touch with ICMR headquarters, and we have a call with them on Friday, on this Wednesday, to discuss in detail how to implement this particular project. But yes, there will be a list of stakeholders who can be part of discussions and provide comments and suggestions during this particular work. A lot of agencies are already working on it, and we would be guided by their experience, and including the industries also. Another linkage to this is Environment and Health Initiative to India. I would just like to take 1 more minute to explain about this. So this is an initiative which we are working with WHO Country Office in India since approximately 2 years now, and with our effort of more than 1.5 years, Ministry of Health and Family Welfare have now established an interministerial high-level steering committee to guide environment and health related work in India. And that is something is the objective of this initiative, that it should be guided by interministerial committee on identification of priorities for work in this area and provide us inputs on different activities. And we have identified 4 different aspects to carry out activities under this environment and health initiative. One is, of course, mainly to provide scientific evidence to guide policy making and decision making. That is something which is also mandate of UNEP. Second is, of course, capacity building. Then advocacy is also UNEP's one of the core mandate, and also then promoting leadership and governance on environment and health in India, to also encourage government to take decisions and take it up at a higher level international meetings on the initiatives and actions they are taking to prevent various kind of pollution and impact of environmental pollution on human health. So that is something, and we have already identified few initial priorities under this environment and health. Of course, we started with air pollution in 2018, and that was something because the work on environment and health initiative started in the peak air pollution season in Delhi around November 2018. And at that time, with NCDC and MOEFCC, they also recommended us to start our work on air pollution and climate change. So we developed some draft training modules on air pollution and human health, and also carried out some activities on training of health officials of Delhi and UP on air pollution. And of course, those draft modules are again to be revised based on the recommendations. Climate change, we have to start work. Waste and chemicals, we are already working We are working on a project on integrated vector pest management to remove DDT usage in malaria control. Water quality and water quality we have not started working, and then very recently we have identified AMR and zoonotic pathogens as our initial priorities. And fortunately, we have also received some funding to carry out work on these two aspects. So we will be starting our on-the-ground work on these projects very soon. So these are updates from UNEP, and we will be happy to collaborate with all of you or getting your inputs and guidance on these projects and beyond, of course. Thank you very much.
Thank you, Dr. Jitendra, for that excellent presentation on environmental dimensions on AMR and also the contributions which the environmental health can bring about in this control of AMR. May I call upon Mr. Satya for a few of his thoughts before concluding this session, please. Satya, please.
Thank you. Thank you very much. I think we heard some very, very detailed and very interesting presentations, very thought-provoking. Of course, the subject is very vast, and I think today maybe we don't have the time to go into any in-depth discussion, but I think the speakers have left us with a lot of information to process. And I would say that these kind of analysis, particularly looking at everything from animal welfare to the need for diagnostics, to the need for much greater investments in this sector, calls upon everybody to work much harder to lobby with governments or agencies wherever we have some reach to bring much more focus and attention to this subject. It's a very vast subject in a period of a pandemic like COVID right now. It's very easy for the world to sort of sideline the issue of AMR. But I think we have always believed at REACT, at least over the last 15 years, that we are working to prevent a major pandemic in the future. And just because the pandemic is not yet fully here, this is the best time to work on it. Actually, if we had the opportunity to work on COVID 5 years ago, the situation would have been very different today. In the case of AMR, we can see it coming. It's not yet here in a big way. I mean, it's there, but it's not in a situation like the COVID thing is so much more urgent. That's why attention is going there. But I think we need to persist with putting together the evidence, coming up with alternative plans, alternative strategies. And as I said earlier, new ideas on how to frame the issue in terms of systems, and also put in much more details into the micro level plans. Because ultimately the change at the grassroots level will have to be planned out very well. Thank you. I hand it over back to Dr. Sunil.
Thank you, Mr. Satya, for your thought-provoking comments. And it has indeed been wonderful to have so many speakers, but we had to manage with this short time. And I think all of the speakers have done a wonderful job sticking to the time. And I thank each one of them for that, for their presentations and their contribution in finally bringing their role into in this control of AMR. Can I hand it over to Dr. Philip, please?
Thank you so much. So much, Dr. Sunil and Satya, for that wonderful session. And I thank all the speakers. I think we have time for at least probably one question. There is a question on YouTube. We've had a live stream going on in YouTube, and this is directed at Dr. Arshnee. Microbial transplantation to minimize the use of antimicrobials in animals. So this question has come from who's an expert in poultry. Dr. Arshnee, are you there? Dr. Arshnee? So I think she may have had a connection issue. So there is one more question, which is quite a generic one, which came from Dr. Rana, which asked processing at the farm level. If though can a government organization take up the certification process? It is not directed at anybody. Does one of the speakers want to answer that? Probably I'll ask the moderator himself, Dr. Sunil. Do you have any comments on this? He's asking about antibiotic-free certification in food producing animals at the farm level. Is it possible?
I think before we go into certification and all these things, we need to devise strategies. Basically, I think for me, it is more of hygiene and sanitation which has to be improved. So there has to be a program for that at the farm level, because now in many of the places, this has been compensated by different mechanisms. So we need to build up the biosecurity of the farms. And only after that, I think once you have that foundation, we can start looking into the certifications and rest of the things. I don't think we should directly be jumping into the certification right away.
So much, sir, for that input. I think there is one last question from Srijit Radhakrishnan. Please, you can go ahead, sir. You can unmute yourself and go ahead.
Hi, am I audible?
Yes, you are.
Yeah, hi. Thanks to everyone for the talks. It's good to see Sunil sir again. He's a teacher of mine. My question is actually to everyone, I guess. It's not to anyone specific. My experience as a person living in India and also as a vet who's worked in India has been that one of the big problems, one of the main causes, I guess, in my belief, for indiscriminate use of antibiotics and antimicrobials is basically the easy availability, in the sense that anyone can go to a pharmacy and buy an antibiotic or an antimicrobial without even a prescription, and they can get multiple doses and they can use it as they choose. So is there a case to be made for strict regulation, I guess, of or basically banning the sale of any form of antimicrobials without a valid prescription? And I was wondering what the regulations are, and if something is already being done in that regard. Thank you.
If one of the speakers want to volunteer, please go ahead. Otherwise, I'll go back again to the moderators, either Dr. Robin Paul or Sunil sir, either one of you, if you want to answer this.
I can answer this if
sure.
Moderators. The regulatory aspects are extremely important, and unfortunately, it's not the lack of regulations in India. It's India has excellent regulations in place regarding the sale of antimicrobials. Unfortunately, it's the implementation of regulations which is the challenge here. And we have Schedule H, we have Schedule H1, which has very stringent sort of requirements for sale of antimicrobials. Another area which, during the National Action Plan meeting and the Delhi Declaration on Antimicrobial Resistance focused on was having a separate regulatory authority for the animal sector, for the food and the animal sector, so that the drug regulator, which is primarily focused on human health, is unable to do justice to the antimicrobial use in the non-human sector, there should be some attention paid to that. So that was one of the suggestions and the proposed activities under that. And hopefully in times to come, once we have a review of the National Action Plan, we would, unfortunately, COVID has played truant in terms of we already had a NAP-AMR review planned for the middle of this year. And so now it's been pushed back, but hopefully regulatory aspects will be addressed as soon as we are able to undertake the review of the National Action Plan.
Thank you, Dr. Anuj. I think for the interest of time, we'll move ahead. So thank you so much, all the speakers, for kindly consenting to participate. I know it's very difficult for people like Dr. Kate, who's based in Singapore, and it should be past midnight for her. Thank you so much for patiently coming online and staying for the whole length of the workshop. A couple of resources that we are REACT is publishing during this World Antibiotic Awareness Week. One is the AMR dictionary in Malayalam and Hindi. This we had developed, basically we translated it based on a resource which was created by Mahidol Oxford Research Unit based in Bangkok. Wellcome had also funded it in the initial phase. So we found that it is a very useful tool to actually disseminate the messages around antibiotic resistance. So and because it is a requirement that we de-jargonize the whole process and kind of translate it for consumption by the general public. So that was the idea of developing this. So this is something. So both Hindi and Malayalam versions are coming out this World Antibiotic Awareness Week. We have also been working with students and children just to iterate the strategies for engaging them more, and basically making sure about what are the possible entry points for engaging children and students. So there's a 28-page comic book on primarily focused on the microbiome aspect and health and hygiene. So that is again coming out during the World Antibiotic Awareness Week. And I'm sure some of you may be on Twitter. So tomorrow between 6 and 7 in the evening, we are having a World Antibiotic Awareness Week Twitter chat. Some of the AMR community is coming together just to kind of chat to each other online on World Antibiotic Awareness Week, and what does it mean for AMR action in India, and what is the way forward. So if you're free, if you're on Twitter, please do try to make it and attend this. Thank you so much for patiently listening in. I invite Dr. Mohammed Aslam, Secretary General of...
One second, Anuj sir has raised hand.
Yeah, sure.
No, it was not raising hand, that was clapping for the wonderful initiative by REACT. That's a clap.
Thank you. So I invite Dr. Mohammed Aslam for the vote of thanks. Thank you.
Thank you, Dr. Philip. Good evening, respected dignitaries and delegates. In fact, this was the second edition of our One Health Summit on AMR. Last year, we had organized the first edition of the event at Kochi, and we came forward with the historical Kochi One Health Declaration on AMR, and the event received well appreciation from various stakeholders. This year also, although we are having so many constraints due to the COVID pandemic, we are dedicated to carry forward the message and efforts in fighting against the AMR, and I am happy that the event went with good participation. In coming days, we will consolidate the suggestions and findings of the session, and we sit together again to formulate the future course of action in this regard. Coming over to my duty, we are fortunate to have a proactive agency like REACT Asia Pacific to associate with on this subject of AMR. On behalf of IVA Kerala, I express a deep gratitude and appreciation for the efforts of REACT Asia Pacific, and also representative Dr. Philip Matthew and his team for giving us full support and cooperation to organize this event. Thank you, sir. Also, it was a great privilege for Kerala to collaborate with World Health Organization in India, and we extend wholehearted gratitude to Dr. Anuj Sharma and his team. Thank you, sir. On behalf of the association and React Asia Pacific, I also thank Dr. Jaya, Dr. Sunil B, and Dr. Satya for moderating different sessions. On behalf of IVA Kerala and React, I thank our esteemed resource persons, Dr. Sharda Devi, Dr. Pankaj Shukla, Dr. Ravindra Agarwal, Dr. Jess Vergis, Dr. Kate Blazak, Dr. Devika Pillai, Dr. Arshnee Moodley, and Dr. Jitendra Sharma for giving excellent presentation. Thank you all. I also thank our state committee member and AMR expert, Dr. Robin J. Paul, for coordinating the event on behalf of the association. Also, on a formal note, I thank Dr. Bobby Paul, our Vice President, for welcoming the dignitaries and the delegates. Finally, I would like to express our gratitude and appreciation to all those participants for attending the session and joining us. Thank you. Thank you all. Good night.